I'm just going to briefly talk about some social work services that a lot of you are familiar with and those that are not. Just to let you know, some of the needs that I am asked to help with are as follows: assistance with medications. Sometimes patients don't have health insurance, but of course we want them to maintain their health and to get their necessary medications. So I will help with patient assistance programs, helping them with their disability paperwork, filing for Medicaid, Medicare, whatever the need may be. We also have some assistance through the Bulwell Pharmacy as needed. Housing resources. Today I had a young gal ask me for an apartment list because she's living in an apartment that costs her $950 a month and her income is like $1,100, so that's just crazy. So we were able to find her a listing of several places that were more within her range, assisting them with the Cuyahoga County Housing Department, Section 8, which unfortunately right now is closed to new applications. Some of the other things, family and coping issues. As Tara said, your mental health is intricately aligned with your physical health. You cannot really separate the two. So there's times you may be feeling a little bit down, you want someone to talk with. Any sessions with me are completely confidential, as are all of our appointments with physicians and nurse practitioners. So please feel free to talk with me. Working with the family. Sometimes we have family meetings which are helpful in coming up with a treatment plan that will help you cope with your sickle cell disease. Vocational needs. Today I was assisting a young lady with a vocational referral. She has not graduated from high school yet, so we're working on that goal. She wished to get her GED or some classes or some kind of training or employment, so that's another area. Removing barriers to seeking care. I think that's really what it comes down to, and as Tara said, trying to get the obstacles out of the way so you can focus on having a life that's outside of the medical establishment. Briefly about Social Security disability. This is something that people have a lot of questions about that maybe have not been able to apply yet. You have to have certain criteria met for Social Security to consider you disabled. Doesn't matter what we say. You have to meet their criteria. Documented painful crises for at least 3 times during the 5 months prior to adjudication. Don't worry about that part. But basically, if you look back during 12 months, have you been in the hospital at least 3 times and not just the emergency room? So there's a lot of criteria, and some people don't understand, well, I have sickle cell, don't I automatically get disability? The answer is no. You have to be functionally impaired in several areas. Vocational needs. I'm happy to intervene with your boss if you've got problems with work. I have a list of accommodations that you can take to your employer and say, would you please sit down and we can go over some ways to make life better for me at work. As Glenda and Adrian will tell you, it's quite a challenge to get people to understand that you need breaks, that you need fluids, that you may need time off to go to the doctor. So we can help with the family medical leave paperwork. Tara and Dr. Little are very familiar with that. We have to do those quite often, and we're happy to do so. Legal referrals. I've helped a lot of folks with filing for disability, and they've gotten turned down several times. When we're able to refer to legal assistance, often that does help grease the wheels. So, if you need any referrals, let me know. And assisting with employment or vocational search. This is tough right now. It's a very, very tough job market in the Cleveland area. And this is one of my goals, is to try to develop a better resource list for you guys, because there's not a lot out there that I am familiar with.